Hi there, Dr. Lauren here, one of the chiropractors at Calamese Family Chiropractic. Today talking to you all about acupuncture, what it is, how it works, and if it could potentially be a fit for you. Now, acupuncture literally meaning to puncture with a needle. The whole design is to stimulate at specific points over the body, intending to elicit a recovery of health. So acupuncture is the insertion and stimulation of needles over given points through the body with the intent to facilitate recovery of health. Now, the approach your practitioner bases is largely dependent on where their training is from, whether that given an Eastern or more Western medicine approach. Now, needles are designed to part through tissue rather than pierce through, which is often why you don't experience too much bleeding. In fact, the needles are so thin that 5 standard acupuncture needles can fit inside the tip of a common vaccination needle. You can see here, they're usually about the thickness of a hair, the length largely dependent on where in the body they're being used. So let's talk, how does it all work? Now, acupuncture is designed to stimulate the nervous system itself, targeting that neurohormone response. Your body releases things like endorphins, those feel-good hormones, serotonin, designed to target towards pain relief, anti-inflammatory response. Needles can also cause minute local tissue damage, which again just tells our brain, let's stimulate some healing in this area. There was a study done in 2006 out of Mayo Clinic where they found a 92% correlation between acupuncture points used over the meridian system as well as local points to over 250 trigger points, those being tender focal spots in a muscle when pressed or palpated, causing a painful response that may radiate other places. So point prescriptions, or the set of needles your practitioner might be using for you. These are often a blend of traditional acupuncture points, which follow along these meridian systems or energy pathways. These are linked to a set of 12 paired organs based out of the Eastern medicine approach. We have our extra points and we have our ashi points, or ouch points I like to call. Those are more centered at targeting the local area of complaint and may correlate with some of those trigger points that we mentioned earlier. Now, although each practitioner does base your point prescription specific to you or to your case, the World Health Organization has come out with an extensive list of conditions that are effectively treated by acupuncture. These vary from a number of things, from body aches and pains, dental tooth pain, different forms of arthritis, induction of labor, painful periods, nausea, vomiting, depression. What I'd like to do is I'd like to take you through my most commonly used point prescriptions here in the chiropractic office relating to common complaints we see, such as back pain, headaches, jaw pain, shoulder and elbow dysfunction. Here you will see a commonly used prescription pattern for low back pain, with both local points in the spinal erectors and midline points targeting those energy systems we spoke about earlier. I will also commonly use distal points away from the site of injury, such as the one on the back of the knee as a command point for low back pain, in the mid-calf for those with sciatica, and on the outer portion of the ankle specific to lower limb injuries in general. Next up, we have points commonly used for different headache presentations. Across the forehead, you will see a set of points used for frontal-based headaches, in the temples or beside the eyes for tension-based headaches, and in those nasolabial folds, so just at the corners of the nose, often used for those suffering from sinus-related problems. Moving on to the back of the head, we have points for suboccipital headaches and posterior neck-based pain. Now, in addition to local points, your provider may also use distal points, similar to this one in the hand, for additional pain relief. Note that most points in this specific video are targeting the muscles themselves responsible for the headache. Here we have a set of commonly used points for shoulder pains and rotator cuff injuries. In addition to those around the shoulder girdle itself, we have extra points in the hand for additional pain relief and shoulder dysfunction. Now, points here are targeting the rotator cuff muscle specifically, as well as additional trigger points found in the area. Our last set of points here targeting elbow pain, or commonly coined tennis elbow and golfer's elbow, largely dependent on which side of the joint we're talking about. With these points specifically, I will commonly introduce electroacupuncture just to enhance tissue healing effect, pain management, and muscle stimulation.